All right. So just to introduce myself, my name is Alicia Youngblood. I am one of the recruiters here at Nebraska Medicine. I primarily recruit right now for the ED and some other units, but I can definitely be a resource to you if you have any questions about any of our units this evening. And I have Amy Mead and Michael Schrod from Bellevue ED, MJ Nelson from Main Campus ED, Tori Georges from Pre-Op Pacu, Cody Pick from Float Pool, and Nicole Niehaus from Cardiac Cath Lab. And I'll check again if I have Denise McGrath from Labor and Delivery. But I am going to just start off by allowing each unit to tell you a little bit about their life in their unit. Bellevue ED, if you can go first.
Yeah, thanks for having us tonight. And thanks. I hope some of you are interested in joining our team in the emergency department. Meg did a fantastic job summing up what we do at Bellevue Medical Center. But just to kind of put it into perspective, so a day in the life in the ED, every day is different. Every day is a little bit variable. So you might have a day where we care for 75 patients in the ED, and you might come back the next day and it's 100 patients. And so it just varies from day to day, experience to experience. We see a little bit of everything from pediatrics to geriatrics, chest pains to strokes, sepsis to certainly COVID. So it always keeps you on your toes. You're constantly learning about new things. It's definitely an exciting place to be if it's someplace where you really like to challenge yourself and learn. I'm going to turn it over to Mike and see if he has anything else to share.
Yeah, so I also mentioned we do a little bit of psychiatric. I don't know if Amy mentioned that, but we do have 2 psych rooms specifically for that. You'll work with a variety of different people and personalities, which keeps it nice and flavorful. I like that. And you can grow here at Bellevue, especially, I'd say, you know, whether it be med surg or the ER here, you can come in as a new grad, you know, and just work your way up. And as long as you have a work ethic here and the want to, you can go as far as you want, I feel like. So I'm a supervisor now. I started as a regular staff nurse, went to a lead nurse, and now I'm basically right underneath Amy, helping keep track of all the staff and help them out. And I really enjoy that too, because I remember what it was like when I first got here. So I like to help our fellow nurses, the fellowship nurses, to grow, and the younger nurses to grow. So the cool thing about here, and I work with the med surg upstairs too, when I transfer patients upstairs or call them to get somebody admitted. And they've always been really good to work with also. So I really enjoy that. I got to shadow a floor upstairs last week with one of their supervisors, and it was really enjoyable too. They're very friendly, and they work well together as a team also. So that's the thing I like about Bellevue. So that's where I'll leave it.
Thank you. I'll take it to MJ for Main Campus ED.
Okay, hi, welcome everybody. I'm MJ. I'm the night shift supervisor in the emergency department. A little bit about our department. We're a 48 bed ED. We see anywhere for up to 120 patients a day. I think last year we saw about 60,000 patients. We see some of the sickest patients in the region and in the city. We are stroke certified, we're cardiac certified, we're trauma certified. We're level 1 trauma, so we take the pediatric level 1 trauma center in the city. So all the pediatric traumas will come to us as well. We do have a unique unit because we have various shifts traditional to the, that's not traditional to the 7 to 7 shifts. So we have nurses that come on at 7 in the morning, 8, 9, 10, 11, 1 in the afternoon, 3 in the afternoon, 4 in the afternoon, and then again at 7 p.m. We have all different kinds of patients. Like I said, we also see a large psychiatric population. And recently we just added our psychiatric emergency services, our PES unit is what we call it. So all the psychiatric patients are first medically cleared in our emergency department, and then we transfer them down to the PES unit. It's definitely a dynamic, fun place to work. It's very challenging. Every day is different. You can see all types of patients. It's a fast track kind of urgent care area. So you could be in that unit one day, and then you could be in the trauma bay the next, and then in the psychiatric area the next. So it's very different every day to day. It keeps you on your toes, and you're continuously learning new things all the time. So if you've been a nurse for 12 years, you'll come to us. If you are a new grad, which I think many of you are, we offer a special fellowship program to new grads, and it's a 6-month program where you learn basics of all different patient populations and get a good foundation for all the different types of patients that we see. So I think that's about it.
Thank you. I'm going to go over to Tori from Pre-Op Pacu. Tell us a little bit about your unit.
Yeah, hi everyone. I'm Tori Georgia. So I'm the manager of Pre-Op Pacu. Our unit is a little different. We're about 5 units in one. So we have a pre-op, a Pacu, and a short stay on our main tower, and then we also have a pre-op and a Pacu over in our Buffett tower. Our staff are trained to all areas, and they float to all areas. We range from very minor procedures, EGD, colonoscopy, simple IR procedures like a tube check, and then all the way up to some of our very critical procedures, cabbages, heart and lung transplants, liver transplants. And then we do see a lot of orthos. We see some of our OBGYN and our surgical oncology patients. The patient populations that we really deal a lot with are going to be more of our acute. So almost all of our patients from our pre-op and Pacu sides are going to be inpatients. So either they are coming from an inpatient bed or they will be admitted. We work very closely with all the procedural areas, GI, IR, and OR especially. We pre-op and recover all of their patients for them. So it's a huge variety of patients. We do require experience before coming to our area. We do not have a fellowship like the ER does. And it's something we've always kind of twiddled with whether that'd be a good idea or not. The big difference for our area than a lot of them is we are a mixture of ER and inpatient. So we have the patients that are coming in, maybe like a routine case where you take an intake on them and then they go back. But we also have a lot of high acuity emergent procedures or patients that come out of a procedure and have an emergency happen. That's why we are considered a level 1 ICU in our Pacu. It's because of the acuity of a patient coming out of a general anesthetic. So it's very critical thinking, fast pace. We typically see about 130 patients, both preoperatively and recovery. So we have about 260 patients that move through our area every single day. With COVID, our numbers have decreased slightly for OR, but our GI and IR patients have never decreased. So we see slightly less ORs, but still quite a few of our procedural areas. So now we're probably averaging about 95 patients preoperatively and then again, recovery. So our unit works very well with all the inpatient units as well. We decide which patients we'll take. Our ICUs in the hospital are typically full very often. So we take a lot of ICUs in our Pacu. We recover them. We wait till an ICU bed is open, but we work with the leads. If there's multiple ICU patients for that specialized ICU, we will decide with them which patient we're going to take in recovery versus which one they'll take in the ICU. Either based on procedure type, or if we've already got them, we'll keep them for longer than to take a new ICU.
Thank you. Very unique unit. I'm going to turn it over to Cody Pick from the float pool.
Hi, everyone. Thanks for being here tonight. So I'm Cody, and I'm the night supervisor for the float pool RNs. So my group, we oversee float pool. We also oversee the swoop RNs. And we also have a float pool fellowship program for new grads with our main float pool. So if you join the main float pool, you'll have the opportunity to float to approximately 21 inpatient units. This does include the ICUs. We don't necessarily train for the ICU, but definitely enjoy having some ICU trained nurses to assist in our ICUs. We do float between main campus as well as the Bellevue campus, so we provide support to both campuses. You do have the opportunity on occasion to go down to our pediatric unit with an appropriate assignment. You also will have the opportunity every now and again to go down to our emergency department here on main campus to help out in their holding area. So a lot of variety. You're going to get the opportunity to really explore your flexibility on a daily basis. Specifically with regard to fellowship. So as far as float pool goes, 18 months experience is what we're looking for. Our fellowship program, though, we do offer to new graduate nurses. It's a relatively new program, really excited about it. We've had a lot of good success with it. I have a lot of really good relationships with our fellows, and that's one of the aspects of my job that I really enjoy is helping get our new graduates up off the ground and see the different variety that they'll be able to, the different variety of patients that they're going to be able to care for. With regard to float pool fellowship, you will float to 4 to 5 different units until you get 18 months of experience. At that point, you will have the opportunity to remain in our fellowship, or maybe you've floated to a unit within those 4 to 5 units that you really enjoy that you want to apply to, or you can join the full-fledged float pool and have the opportunity to go to the 21 different inpatient units. So that's kind of us in a nutshell. It's really great opportunity to see just a lot of different variety on a daily basis. So, thank you.
Absolutely. Thank you. And Cardiac Cath Lab, we have Nicole Niehaus.
Hi, I'm Nicole. I am the manager of the Cardiac Cath Lab. In my department, I kind of have 3 separate departments. We house electricians and plumbers, believe it or not, but the electricians are the ones that are taking care of the electrical side of the heart, and that's the EP lab. The plumbers are the ones that are taking care of opening the vessels in the heart, and that's the Cath Lab. The other area that I have is the holding room, and that's the pre and post for our procedural patients. We do about 25 to 30 cases a day, so we're pretty busy. A lot of those cases could be titled the same, like left heart cath, but never are they ever the same. We have patients with all kinds of different anatomy and physicians that use different supplies or equipment. And so it's always different. It does not get boring, I can promise you that. Our holding room it preps our patients, it recovers our patients, and then we keep patients overnight. So we don't have to admit our patients to the inpatient side. We can just keep them in our own area overnight, which is pretty nice. We take care of adult patients only. The little kiddos get taken care of generally at Children's. We do have a unique relationship with the children's physicians and with the chronic patients. After they outgrow the children's hospital, they start coming over here for congenital follow-up. They can't be seen at Children's anymore after the age of 24. So then those physicians will come over here and do procedures on those adult patients in our department. So we do get to learn interesting things about those congenital patients. In our pre-post area, we have 18 pre-post private rooms for our patients. We have 3 procedural areas where we do like TEE, cardioversions, things like that. And then we have a radial lounge that we built that has 5 bays for patients that have a quick and easy recovery. We have 7 Cath Lab and EP lab rooms and a hybrid room where we work closely with the OR. We staff our patients 24/7 or 24 hours, 4 days a week in the holding room. And so we have 8-hour shifts, 10-hour shifts, and 12-hour shifts and overnight. And then our lab staff have 10-hour shifts on days. I think that's all I know.
All right. Thank you so much for sharing a little bit about each of your units. I do have one other question for each of you guys before I turn it over to our participants with any questions that they have. If we can go back again and talk about who is the ideal candidate or future employee for you and your unit and what you look for in candidates. We'll go back to Bellevue ED.
So I look for somebody who is passionate about caring for patients, someone who is really driven and is a fantastic team player, and then someone who's excited to learn, because there's always more that you can learn in the emergency department, and constantly being curious is something that will help you to thrive and do really well. Mike, what would you add to that?
Yeah, somebody who's just willing to work pretty hard always helps for sure. And just like Amy said, I mean, somebody who's willing to ask questions and just learn, because it's just a great learning environment here. And if you're willing to do that, we can teach you what you need to know. So thank you.
Thank you. And MJ from Main Campus.
I definitely agree with Amy that you have to be very flexible and eager to learn. In our department, policies are continually changing and best practices as well. So with our specialty patient populations, you have to have a diverse knowledge base. So you have to be very eager to learn, energetic, always on your toes. And then we take care of some very sick patients. And so 1 minute it could be pretty slow, and then the next minute, all of a sudden you have a patient who could be coding and doing CPR. So having that flexibility and being cool and calm under pressure.
Thank you. And Tori from Pre-Op Pacu.
So I echo a lot of what Amy and Michael and MJ just said. We take need a lot of flexibility in our area. Things change very quickly. We are a little bit luckier, especially in our PACU side, where we have to follow Aspen standards. So our nurses can only have 2 patients at once immediately post-op. That increases after the initial phase 1 recovery, but because every patient coming out of a general anesthetic has a high risk of airway emergencies, we just require a lot of critical thinking, fast-paced environment. I said that the numbers that we push through our areas every single day, and we take from all of our inpatient and our ER settings. So we've gotten a lot of really great nurses from the ER settings once they maybe want to try something new, and same with our inpatient. We used to be that place where everyone would go to retire. We've changed a lot to be a little bit more fast-paced. A little bit more interesting than it kind of used to be, a little slower. So if you're ready to learn and ready to work, we will take you.
Thank you. And Cody, for that float pool, just keeping in mind all the different areas that you support, what's the ideal candidate for you guys?
Yeah, I think echoing a lot of what some of the other leaders have mentioned is that we're looking for somebody that's flexible, somebody that has solid work ethic, somebody that is willing to learn and excited to learn on a daily basis. There's no doubt in going to all the different units around the hospital that you're going to encounter things on a daily basis that you may not see for months. And just being comfortable asking questions and really pursuing your education and just learning and taking something new with your practice each and every day. So we're looking for somebody that's driven and ready to tackle the day's challenges. Thank you.
Thank you. And Nicole, Cardiac Cath Lab.
Yeah, I would echo everyone else's thoughts. I think working for an academic medical center is really important, and it would show in all of our areas. If you are willing to learn and show interest, our physicians and fellows and residents love to teach. And it's really a fun experience because they will put in the time as much as we're showing interest. So I think that's important. We are very specialized in cardiac care. And so obviously it takes time to learn it. No one needs to walk in knowing everything. But if you're willing to learn, use those critical thinking skills and have fun, we'll get along great.
Thank you. And I'd say it all goes back to our I Teach values. If anyone's looking to join, a unit within the Nebraska Medicine family, those I Teach values are definitely what we look for in each and every candidate as well. I am going to go ahead and turn it over to some of our participants. I would love to give you the opportunity to ask any questions that you have about to one or multiple units here. This is your time to kind of interview the team before you have that opportunity to interview yourself. So if you want to take yourself off of mute, hop on camera, if you would be so bold and confident, we definitely welcome any questions that you have. All right, well, if you're still thinking, I will throw out another good question to the team, but we definitely want to allow you this time to ask any questions. We have about 10 more minutes before we go back to the large group. But let me go back and ask each unit, what's the most unique case your unit has seen? I'll kind of mix it up here. Nicole, I'll throw it to you first this time.
Well, unique, we see unique every day, but I can, I'll share. Last week on the 11th, we deployed a stent called the Megatron, and it was the first in the world. And so I get to brag. It's very exciting. Not only are we working with academic physicians who love to teach, but their research is also very important. And so we had a physician that was part of the research that helped create this new stent. This new stent is meant to go into the bigger vessels of the heart and save a patient from having open heart surgery. So very, very exciting. But it's cool to get to be the first in the whole world to do that. So I'll brag a little bit.
Yeah, absolutely. Good for you guys. Wow. I'll turn it, Cody, anything unique or the most unique case you have seen or heard of from your team?
Ooh, that's a loaded question because we see a little bit of everything. So, I mean, you could be, depending upon your experience level and what you like to pursue, you could be down in our cardiovascular ICU, maybe taking care of a person that's possibly on like ECMO. If you're trained in that area, we have a few nurses that have pursued that. So they're, have a machine that's circulating their blood and is operating as their lungs for them. Man, I mean, that's kind of something that's really sticking out at me right now. So that's pretty amazing that we were able to do that here on main campus. Just a lot of variability.
Absolutely. I'm going to ask Tori from Pre-Op Pacu.
So we do a lot of different work with different providers and surgeon groups, and we do a lot of innovative things. But one of our better accomplishments is doing our kidney chains. So we do work with our transplant surgeons and nephrology team, and we do these massive chains of kidneys, and they're all anonymous. So our team, my team, from the waiting room staff to the pre-op to the recovery staff, get to work with these patients and their families. And it's all anonymous, so it's this big ordeal, and they know it's anonymous, but just getting to work with people and see their transition as these people are so thankful to get these kidneys, and the ones that are giving them are very thankful, and most of them have the first person that does a chain usually has no connection to anybody else. So it's really awesome to see that person and then see all the other ones that were willing to give to their loved ones that weren't able to, so then they're giving it to someone else to keep this chain going. Our last one, I think, was 13 people. So 6 donors and 13 recipients. So very exciting for us when we get to do these.
Absolutely. That sounds amazing. I'm going to turn it over to both departments, Bellevue and main campus ED. And again, just the most unique cases that you guys have seen in your units.
Usually I do get the question, what's the craziest thing you've ever seen? But in regards to some of the unique things that we do there in the emergency room, it was kind of already mentioned, post-cardiac arrest. So when someone's heart stops pumping on its own, we do have different techniques that we use to help after survival quality of life. And so one thing that we're now vamping up is our targeted temperature management. And so after a patient is post-cardiac arrest and has their own heart rate back, we put special pads on them filled with water. And so we slowly cool the body and then slowly warm the body to help prevent any secondary injury to cells that may have not had oxygenated blood. We also have cases where post-cardiac arrest or during cardiac arrest, we put patients on ECMO, and that's basically a procedure that we access their vein and their artery, and it works as a heart and lung machine for that patient until they can get other organs, vital organs stabilized. And so those are just a couple unique things that we do. And then we also see patients from all over the Midwest that come for interventional radiology procedures. And that's where for stroke patients, if a certain vessel is causing occlusion within their brain that's shutting off blood flow from a certain area causing them to have stroke-like symptoms, we can see them in the emergency department and then transfer them immediately up to IR, where they can cath the patient and open up that blockage. So the area of the, just like in Cath Lab, the area of the brain can get blood flow back to it, and hopefully they can have a good recovery. I don't know, Amy, if you have something else or Nick.
Bellevue, yeah, Bellevue for us, something new is our OB department has gone over to the main campus the past year. So we've delivered 3 babies this past year at Bellevue, which we didn't do in the ER before. So that's new for our staff and has kept us on our toes. So we've done some training with that and some positive pressure ventilation with the neonates. So Amy, you have anything to add to that?
Yeah, no, I would say that's probably the most significant thing. You know, we spend every day trying to ward off death for our patients, but this was really the first time that we've been involved in that, bringing life into the world. And so it was definitely a new experience. And the first time that we had a baby born in the ED after our labor and delivery services relocated to the main campus, the security team played the lullaby, and it was a really powerful moment for everyone. So it's kind of been, although it was something we never wanted to see go away, it was a really cool experience for us.
That's wonderful to hear. Thank you for sharing those examples. I do want to turn it over. We have just about 2 more minutes, so I want to give another opportunity for our participants, Tara, Jocelyn, or Lynn. If you have any questions for any of our managers and supervisors, we would love to hear from you.
My name's Tara, and I am in my last semester at UNMC in Lincoln. And I'm sorry if this was already answered, but I was wondering what the fellowship program entails.
So the fellowship program for our emergency department, it's approximately 6 to 12 months in length. It's catered to what your learning needs or requirements, but it goes through pretty much every different type of their specialty in pediatrics. They go over cardiac, neurology. They have in-hospital kind of opportunities where you can go up to the PICU, the CVICU, and then we also have a pre-hospital experience where you can ride along with Omaha Fire Department. And so it's kind of just gets you a good foundation for emergency care. We usually typically hire into that in May and December for new grads.
And then I like to put a little plug in that because both MJ and I were graduates of the fellowship program. So.
Thank you for that question. Any of our other participants? We have about 30 seconds.
Yeah, so Float Pool Fellowship, it's an 18-month program. For the first year, you'll be in nurse residency with all new graduate nurses. And in addition to that, you'll have 5 months of fellowship, which is an additional area just to meet with other people, other nurses that are going through the fellowship. Orientation entails, I'm about to get cut off.